With dozens of student volunteers and countless containers of makeup, Riverside University Health System prepared for an event it hopes never happens.
So today we're testing and training for an event of a mass casualty incident. As we know, disasters will happen whether we're prepared for them or not, and we've taken a proactive stance here at RUHS to go above and beyond to be prepared for the next disaster.
50 volunteers from Vista Del Lago High School, Riverside County Emergency Management Department, nursing students from Riverside City College, and paramedic and EMT students from Moreno Valley College played roles ranging from gunshot victims to emergency transporters. The imagery was graphic, and as tough as it is to see these sights, the realism played an important part in this process.
We wanted to take that extra step so that we have that visual stimuli so that you're under the pressure and under the realism so that we're not in that state of shock when a real event happens.
As it turned out, it was a valuable experience for the volunteers acting out the role of victims. Jessica Villapondo is a nursing student at RCC. The role she drew involved a serious injury, and she had plenty of time to reflect as the makeup was applied.
I feel like it's very interesting because I am used to being the caretaker, but now I'm like the patient, and I can't imagine what a patient would actually feel if this was happening. Just looking at it is like, oh my gosh, you know? So it feels very exhilarating, and it feels like I get to understand what the patient is feeling and going through.
Another RCC student was Nicholas Giotto. He was tasked with playing an important role in this drill, although it would be different from his coursework so far.
We've done med-surg and OB, we're second semester, so we haven't gone to like emergency room or anything like that. I think maybe we get that in like our last semesters perhaps.
He wouldn't have to wait a semester, because that emergency experience would come in a matter of moments. Code triage drill beckoned over the hospital loudspeaker at 9 a.m. Seconds later, the first patients arrived at the emergency department entrance, and the RUHS team sprung into action.
14-year-old female, gunshot wound to the head with brain exposure.
Jessica was one of those first patients, and the team soon learned just how serious her injuries were.
Oh my gosh. It's okay, don't look at it, okay? Don't look at it, it's okay.
It wasn't just frontline healthcare workers involved in the drill. An emergency operations center was set up in the medical center to assess everything from bed space to blood supply coordination. After 2 hours, the drill wrapped up, and the hope is that the lessons learned from these sobering scenes will not only benefit hospital staff, but Riverside County as a whole.
We want to be ready to serve our community so that we can deal with the influx of patients and effectively treat those emergencies and the day-to-day emergencies